Our paper is about Medicaid, one of the largest government insurance program for the Americans in poverty. Because it is a means-tested program, Medicaid has certain requirements for the assets of the applicant so that they can be eligible for this insurance. And there is a concern that people might strategically offload their assets to become Medicaid eligible. And so our paper is about testing whether people are strategically doing so for the insurance eligibility. Specifically, we look at the transfer between the parents and the children because such transfer are easily made and it's not easy to be detected, and they still keep the money within the family. So what we do is we sort of study the impact of a policy change. The policy change is made in 2006, and it basically increased the penalty of the behavior, the transfer that are deemed improper. So we look at whether people would sort of decrease such transfers because of the policy change. And we also look at how the probability of using nursing home care in the future might affect the people's behavior. So the main finding of our paper is that people do seem to strategize their asset offloading. So specifically for those people who with a high probability of nursing home care, over a 2-year horizon, we find they reduce the frequency of transfer to their children by 10%, and the average total amount transferred is reduced by $1,700. And we also find that the effect is more concentrated in those people who are less financially literate. We also look at home values of the survey respondents, and we do not find that they change their home value in response to this policy. Because there is a concern that people might game the system to become Medicaid eligible, so our study provides some evidence that about to what extent people might do this strategic behavior. And so this applies in itself to Medicaid, which is an important policy topic because it's a very large program. And we believe it also applies to other means-tested government insurance programs in other countries in general. And we find that the new policy that increased the penalties for such behavior seems to be effective, which again might have implications for policy making or for other countries' programs as well. But saying that, we also recognize that those people applying for Medicaid, they are in poverty and they face really difficult decisions, which in terms of their their long-term care needs, this is made worse by the extremely high cost of nursing homes in the United States. So we think our research also sheds some light on how fragile people are to these long-term care needs.